Hello, Miss Guri, and thank you for coming to your appointment today. There were a couple things that I noticed when doing your clinical exam as well as on your x-rays, so I kind of wanted to discuss those with you if that's okay. So the first thing that I noticed is on the upper right side, you do have some gum recession. Closer to these molars in the back. I know that you mentioned at home you're currently using a medium bristle toothbrush, so that could be leading to the recession of the gums. If you're using a toothbrush that's very abrasive, it can cause damage and make those gums recede, and unfortunately those areas will not grow back. So what we'll want to do is I'm going to give you a soft bristle toothbrush to start using today. And from now on, you're going to go ahead and use a soft bristle toothbrush. So if you have to go to the store to buy one after today's appointment, in the future, you'll want to purchase a soft bristle toothbrush, okay? So the other thing that I noticed is there was some plaque along your upper left side toward the back, toward the molars again. And so it looks like there, with that plaque, that it's hard for you to remove it, since I know you said it's a little tough for you to see. So I know today we discussed maybe purchasing or using a magnified mirror, something that will help you to see a little bit better towards those back areas. Also, the brushing method that we discussed, the bass brushing method, which I'm going to show you here in just a moment, will kind of help you to brush a little bit better along the gum line. On your front teeth, there were some areas between the teeth that needed some addressing, but we're going to talk about flossing so that way you can floss and make it a little bit easier to get those areas clean. So I know you had mentioned that you do have some joint pain at times, mostly in the hips, but I know that other areas can start to bother you as well, especially if you suffer from arthritis. So I'm going to show you a simple way to change your toothbrush using, a household item. Typically, patients can use like a tennis ball, use a bicycle handle, but something that I have here in the office and that most people have at home is saran wrap. So you can use any sort of saran wrap. It doesn't have to be anything fancy, but basically you're going to get the saran wrap and you're going to just circle it around the toothbrush. And what that's going to do is make that handle thicker for you, so it's a little bit easier to grasp, easier on your hands, and you can make it, as thick or thin as you want to. So in doing this, hopefully it'll make it, a little more comfortable for your hands. Alrighty, so you can see, just like that, it's made it a little bit thicker. It's a little bit easier to grasp. You don't have to close your hand so tightly. If you wrap it like this and you feel like you need a little bit more, then you can definitely add a little bit more. There's not, any point where you say like, oh, I have too much. If it's comfortable for your hand, then that's all that matters. Okay, so we've made it a little bit thicker, a little bit more comfortable. And then what we're going to do now is go over the bass brushing method, okay? So the bass brushing method, again, remember, it's 45-degree angle against the gum line. And then you're going to do that little vibratory or jiggle motion along the gums. And you're going to do that for about 10 seconds per area, okay? So you'll do that all the way around your mouth, especially remember this is the area we wanted to focus on, up here on your upper left. So you're going to really reach back there with that toothbrush so that you can get all that plaque removed, okay? So I feel like this trick here is going to definitely help you to grasp that toothbrush a little bit better. Even if it's a little difficult for you to see, I think you'll kind of be able to feel that it's making a difference with this handle to get further back there to clean, okay? So that's the brushing method. You're going to also make sure that you brush your tongue. There was some plaque built up here on this side, and so you want to make sure that you're brushing your tongue. That plaque and bacteria can cause bad odor in the mouth, and so if you remove it, then you won't have that bad odor. The other thing that we're going to talk about is flossing. So you can have food debris and plaque trapped between the teeth, and that can also lead to bad breath, and so we want to prevent that by flossing. So you're going to get a piece of floss, and usually you want to get about an arm length. Sometimes you'll have to use more. So for each section or each area that you're going to floss, you're going to use a new piece, okay? So you'll loop it around your, I use my non-dominant hand to wrap it around very loosely, or excuse me, tightly, and then For my dominant hand, I wrap that around a little bit loosely so that I can move to a different area pretty easily and not have to get it stuck on my fingers. So you're going to go between the teeth, and you just have to put it in very gently. You don't have to use a lot of pressure. And you're going to get that floss, and you're going to wrap it around in a C-shaped motion, and you want to just go up and down a few times. That's going to help you to get all of that plaque and food debris off. After you've flossed that tooth, then you're going to come around to this tooth on this side and the same C motion, and you'll pull it out, and then now that's when you're going to advance the floss. So you'll wrap it around, and then you'll go to the next section. So let me show you here on these molars to see if it's a little bit easier for you to see. So again, you'll go between, and you're going to go up and down here. And if it comes out, just put it back in, and then up and down on that side, okay? And you're going to really try and wrap that little C-shaped motion around. So you'll do that throughout the entire mouth. Now, I know that we also discussed that you were eating cough drops, so that is a pretty large amount of cough drops that you're using, which could be the reason that we have those large areas that the doctor noted that were cavities back here on these teeth. So with those cough drops, you have them in your mouth constantly, and they usually kind of sit back there. And so all of that sugar and acid is on these teeth back here, which, you know, more than likely is the reason that we have those areas on those teeth. So what I would recommend is that you definitely cut down the use of the cough drops. If you are having a persistent cough, then you may want to see your physician just to see what's going on, see if they can give you an oral medication that can maybe help. If you do need to use a cough drop, I would recommend maybe using a sugar-free one, but definitely not as consistent as, you know, the 12 to 16 per day. The other thing is we want to go ahead and lessen the carb intake. So if you want to have carbs like, you know, breads, the crackers, the cookies, things like that, I would definitely recommend doing those with a meal. And not doing them as a snack by themselves, just because you're bathing the teeth in those acids, and doing that can lead to cavities, as are, you know, currently present in your mouth, and you're at a higher risk definitely right now because you do already have active decay. So those were just a few things that I wanted to discuss with you, and I hope to see you back in a few months, and I hope that there definitely is some improvement by the tips that we talked about today. Thank you.